Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. Vaccine hesitancy and vaccine non-adherence continues to be a major public health crisis in the United States today. The fact of the matter remains, even though there are infectious diseases, vaccine preventable infectious diseases out there, there is still a significant preponderance of these diseases. So, looking at the Centers for Disease Control and Prevention and their wonderful website that they've put together, they've compiled something called VaxView. And this is actually a system of websites that provides information about vaccine coverage data for all ages. And this is looking at state level, national level, and even local level data. So we start off by taking a look at each of these tabs, and we look at Child Vax View. And so this is looking at data for children from 35 months of age to 19 years of age. So the data is available for vaccines routinely recommended for young children by the Advisory Committee on Immunization Practices, ACIP. And these were practices that I was oftentimes making sure that I was well versed in, because when I was seeing pediatric patients in the clinic, and they were the main thing that parents were concerned with is where their children caught up in immunizations. And according to the ACIP guidelines, we needed to make sure that these were followed. And so this gives you a quick snapshot, a quick overview of the vaccines and if they have been actually administered effectively. And the two vaccine preventable diseases that are important to be thinking about is measles and whooping cough. One thing that many people may not know about whooping cough, which is caused by pertussis, is that a lot of times the immunity wanes. Typically, every 10 years, the immunity begins to wane. So after a while, the immunity begins to wane. So this is one reason why, even if you are immunized, sometimes people do get whooping cough. Anyway, so this is a brief overview of the child vax view. Now, what I like about this website is that this look at this public health problem. This website is arranged in such that this is looking at the vaccine hesitancy problem from multiple perspectives. So this can give you some idea about the types of research questions that you might be asking from the perspective of various age groups or various contexts. National Immunization Survey, I want to bring to your attention, is a good data set to be looking at for for secondary data analysis. Now we'll move on to school vax view, and so the idea is that each school year, state and local areas report the estimated number of children attending kindergarten who have received the recommended vaccines. And you can look at very elaborate tables and look at the data that's being reported. And there's an interactive kind of view that allows you to take a look at the coverage and then see how that has changed over time. And fortunately, due to policy recommendations and enforcement of policy, coverage of immunizations such as diphtheria, tetanus, and pertussis, as reflected by the graph that is being shown, that is being displayed. That coverage has stayed pretty high consistently high, not at 100%, which is not ideal. 94.6% has slightly gone up in recent years, but we're not still in 2021, not at 100%. And so this is looking at 3.5 million children. So, we have to get this to 100%. Um, so this is an example of how some of these immunization vaccine coverage data that you can use to pull up existing research. And note that when we are looking for a novel research problem or research idea, it's important to look at the trends that are existing already. What do we already know? And we know quite a bit, but um, it's not enough. That's the idea. There's exemption trends that you might be looking for specific vaccines. So um, maybe there was a non-medical exemption, and maybe they're on the rise. Non-medical exemptions. Here we see they actually went down. But if there is a specific type of exemption that people are using more of, that might be a sign that you want to target a specific type of exemption that people are are using. And so these may be legitimate exemptions as well. Um, so just understanding the exemption is helpful. Um, This kind of shows the levels of vaccinations by state. So, as we can see, Maine needs a little bit more work. The coverage estimate is only at 94%. Georgia needs quite a bit of work, has a staggering 88.5% rate. So this MMWR rate is pretty low, and then Colorado and Idaho also have some abysmal vaccination coverage rates for diphtheria, tetanus, and pertussis. So let's maneuver back to where we started so that we can explore some additional topic areas. So I skipped a couple of steps. I brought us back to the main page menu so that I didn't have to waste time trying to maneuver through that. So we went over child vax view so far. We went over school vax view so far with the data on the kindergartners. Now let's move on to teen vax view. And so Teen Vax View is adolescent vaccination coverage for vaccines routinely recommended by the ACIP for preteens and teens. So typically, I went over diphtheria, tetanus, and pertussis, DTaP, which is usually for children. But then in adolescents, you actually require something called Tdap. So it's still tetanus, diphtheria, and pertussis, but it's actually a different formulation. So this is used in teenagers. And so this also includes HPV, which is at the center of national discussion in terms of preventative measures and where to administer this. Um, there's also meningitis and other vaccines. So these are all considerations, and again, you can also get reports of coverage based on enrollment. There's a NIS teen um, data set that you can use to look at teen and pre-teen vaccination rates. And then, of course, you always have the behavioral risk factor surveillance system, which can provide you and fill in the blanks with everything else. And then this flu is another vaccination coverage that can provide you with wonderful insights and information regarding vaccination rates in different places. So now that we have gone over all of those, now we can end with Adult Vax View, Flu Vax View, and COVID Vax View, which all also operate in a similar fashion. So if you're looking for quick sort of information about vaccination rates and coverage among adults, this is all again very important. And adults were looking for slightly different types of vaccinations, such as pneumococcal, Tdap again, shingles. Of course, this is reactivation, herpes zoster from chickenpox, and other vaccinations that are important to make note of and take note of. So data for local areas, Health and Human Services, national state areas are, of course, still available through the behavioral risk factor surveillance system, but also through long term care minimum data sets and other reports from the National Health Interview Survey. Here are some, I'm going to end with some related pages that I've been kind of mentioning all along. And those are the WHO UNICEF estimates of um, national immunization rates. That's important, and for some reason this cannot be found currently, but um, that's always a good one. But also looking for making sure to note about vaccine safety. There's also an immunization action coalition where people are, it's called immunize.org, and people are looking for kind of translating information from healthcare professionals to the public. So there's a index of all the different types of vaccines, and this gives you a list and gives you information, up-to-date information about the different types of vaccines and what to expect, questions and answers from patients, from parents, and everything in between. So I've gone through quite a few of these. I've gone through websites that you can be visiting, but the main website to be thinking about is the CDC website. So this is CDC, www.cdc.gov/vaccines, and then you can go into related links with adult vaccine, teen vaccine, school vaccine. And so um, there's actually linkages with healthcare effectiveness data and information set measures, linkages with Healthy People 2030 as well. So at the end, what I'm trying to say is that bringing it all together, bringing all of this full circle, all of these are related and connected, and so it's really important to understand how all of these work together to create the topics that you're interested in researching in your research area. Thank you for listening.